We've all heard about the healthcare workforce crisis that's hitting communities across the nation. But instead of just waiting for a solution to appear, some places are building their own. So let's dive into how one state is strategically creating a pipeline to grow its own healthcare heroes, starting all the way back in high school and seeing them right through to practice.
And that really is the question, isn't it? This is what Pennsylvania is trying to answer right now. And it's definitely not just some academic exercise. The health of millions of people, especially in those rural and underserved areas, literally hangs in the balance. And here's the absolute core of the problem. It's not just a shortage, it's what experts call a maldistribution. It means the healthcare professionals they do have, well, they aren't where they're needed most. This creates these huge gaps in care, kind of like healthcare deserts, and that's the specific problem this pipeline is designed to solve.
So, where do you even begin to tackle a problem that big? Well, not in medical school. You've got to start years, even a decade earlier. The very first step is all about inspiration, planting that little seed of a potential career in the minds of young students.
And they are not thinking small here. I mean, just look at this number. Their goal was to reach about 1,000 students a year. Instead, the Pennsylvania Area Health Education Center, you'll hear it called PAHEC, reached almost 14,000 students in just 2 years. That is a massive, massive investment in the future.
And this right here, this is the impact behind that big number. For a lot of students, especially if they're from a rural area or a background where nobody's gone to college, a career in medicine can seem totally out of reach. A single experience, one opportunity like this, can completely change that person's entire life trajectory. And this isn't just about handing out a few brochures. The approach here is so much smarter. It's multifaceted and totally hands-on. We're talking about career fairs where students can actually try things like suturing. They're doing tours of med schools to demystify what it's really like, and they're even breaking down financial barriers with things like discounted test prep. It's all about making this path feel real, tangible, and honestly achievable. Okay, so that initial spark is lit. Let's move to the next phase in the pipeline. Now the focus shifts to nurturing that interest through the really demanding years of university and intense clinical training. And again, the scale here is just so impressive. Over 4,600 health professional students. These are our future doctors, nurses, PAs. They all got specialized training. And it was focused specifically on the unique challenges of rural health and primary care. They're not just learning medicine, they're learning the context of where that medicine is needed most. And this chart just brilliantly illustrates the so what factor. I mean, it's one thing to offer training, but does it actually work? This shows the self-rated confidence of students in the AHEC Scholars Program. Just look at that jump in their belief that they can provide care in underserved areas. This isn't just about knowledge. It's about building the confidence that they can and will succeed in these really tough environments. Okay, this is where the rubber really meets the road. You have to put theory into practice. And check this out, a staggering 88% of the clinical rotations supported by this program happen directly in medically underserved areas. So students aren't just reading about the need in a textbook, they are living it, breathing it, and training in the very communities they might one day serve. And what's really fascinating here is how the program evolved. They learned and adapted. They moved away from this old broad brush model that, honestly, spent resources on students who had no interest in rural care. Now they use a laser-focused core model. This new approach invests those precious rural training slots in students who are genuinely committed, which makes the whole system way more efficient and effective. Now, this pipeline isn't just for doctors and nurses. It recognizes another absolutely essential role, one that acts as a vital bridge between the clinic and the community itself, and that's the community health worker. So you might be asking, what exactly is a community health worker? Well, think of them as navigators, advocates, and connectors. They come from the communities they serve, so they have this unique level of trust and understanding. They're the ones helping patients figure out insurance, find resources for food or housing, and overcome all those real-world barriers that so often prevent people from getting care. They're incredible. And Pennsylvania is going all in on this. By smartly leveraging federal grants, they were able to train over 500 new community health workers in just 2 years. I mean, they rapidly built a whole army of frontline public health advocates across the state. And this didn't just happen by accident. It was a really clear 3-step strategy. Step 1,
get the funding. Step 2, execute high-quality training. And step 3, and this is so key, create a formal apprenticeship program. This professionalizes the role, gives them paid experience, and creates a real career path. So, did it work? Well, the results really speak for themselves. This program has incredible staying power. A 70% retention rate after 1 year? That's fantastic in any field. But get this, 75% of those still on the job are working in the exact rural or underserved communities where they're needed most. And when 100% of your graduates say they felt prepared for the role, well, that's a home run. Okay, so we've seen the educational impact, we've seen the community impact, but what about the bottom line? Let's talk about the economic payoff of this long-term investment. Just take a second and let that number sink in. $1.1 billion every single year. And remember, this isn't from the entire healthcare system in the state. This is the economic output generated by just 510 primary care doctors who are connected to this AHEC pipeline program. It's just, wow. And this table shows how that incredible impact ripples through the whole economy. A doctor's office isn't just a place to get care, it's a local economic engine. Those 510 physicians support nearly 6,500 other jobs, they generate over $500 million in wages, and they contribute $44 million in state and local taxes every single year. Investing in healthcare isn't just a social good, it is a direct investment in the state's economic health. But, and this is really important, this isn't a simple fairy tale success story. We have to acknowledge the massive headwind they're fighting. Even with all these amazing efforts, keeping medical graduates in primary care is incredibly tough. That 9% figure isn't a failure of the program, it's a sign of just how deep the national pressures are. You have staggering student debt pushing graduates to higher-paying specialties. You have intense burnout. It's the tough reality this pipeline is up against. So after looking at all this data, the incredible successes, the sheer scale of the effort, and those persistent challenges, what's the real takeaway from Pennsylvania's experiment? And here it is. The most crucial point is this. There is no single magic bullet. You can't just build one new medical school or offer one scholarship and call it a day. Building a healthy workforce requires a sustained, strategic investment in every single step of that journey. It's a long game, and every single link in that chain matters. And that really leaves us with a final forward-looking question. This pipeline is powerful, but it's also fragile. It relies on consistent funding, on strong community partnerships, on dedicated mentors who show up year after year. The real challenge now isn't just building it, but ensuring it's strong enough to keep delivering care for generations to come.